most common cause for itching and scaling of the scalp. So what is dandruff? Dandruff is nothing but a physiological scaling of the scalp. Like anywhere else in your body, the dead layer of the skin exfoliates. The similar process happens in your scalp also. When it becomes visible, we call it as dandruff. So dandruff is not a harmful condition, but it could be annoying or embarrassing to the patient because the flakiness becomes visible on the hair and on your clothes, and people may relate it to your hygienic practices. Apart from dandruff, dryness of the scalp because of the over usage of shampoo, over combing, over washing, or sun exposure can lead to dryness of the scalp. That also leads to itching and scaling of the scalp. But in all these conditions, it is not associated with any redness or reddish patches. But when the scaling and itching is associated with the redness, it has become inflammatory in nature. Then we have to think about other causes. Among that, seborrheic dermatitis is the most common cause. In seborrheic dermatitis, what happens is that you have a lot of oily glands on your scalp which will produce an oily secretion called sebum. And you have a fungus called malassezia that is a part of your normal skin microflora. So this fungus acts on this sebum to produce inflammatory mediators which will lead to this redness, scaling. So this condition affects not only the scalp but also your eyebrows, eyelashes, nasolabial area and chest. Then scalp psoriasis can also present with the dry whitish scaling and reddish patches. Then allergic contact dermatitis, because of the products you are using on the scalp, mostly associated with the hair color and hair dyes, can also lead to itching, redness and scaling. Then fungal infection, that is Tinea capitis, especially in children, can present with patchy areas of scaling, itching and hair loss. So mild dandruff can be dealt with a regular usage of a gentle shampoo, and if this does not work, you can go for a anti-dandruff shampoo which you have to use 2 times or 3 times in a week depending upon the severity of the dandruff. Then most important thing is you have to develop a scalp and hair care routine depending on your type of scalp and hair. For example, if you have an oily scalp, you have to minimize the usage of oil. You can more frequently use the shampoo and reduces the usage of styling products because that can lead to buildup and more oiliness. But if you have a dry scalp, you can use oil to moisturize your scalp, and you have to reduce the frequency of shampoo. Then definitely you need a good diet which is rich in vitamin B12 and zinc. So with these measures, most of the mild dandruff can be controlled. And suppose if it is not improving or this scaling and itching is associated with the redness, then you need a specialist consultation because it could be due to other causes, other inflammatory causes which we have discussed earlier. So finally, the take-home message is that the itchiness and scaling of the scalp is most commonly due to dandruff, which is not a harmful condition. But there are other severe conditions can also present with itching and scaling of the scalp where you need a dermatologist's opinion for diagnosis and management. I hope this session is useful for all of you.